Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Yeah, I'm living it up. How about you?
I'm living it up.
Good. What does that feel like for you?
It feels like not having any pain in your body, which is our topic on this program, because we want people to be able to cope, get rid of their musculoskeletal or orthopedic pain, right? How are we going to do that?
Well, coping is not the answer for me. I'd rather get rid of it. Coping is what traditional medicine does with medications and surgeries that I don't find help. So what we do is something that is becoming more and more known, but a lot of people still don't know about it, which we call regenerative medicine. Regenerative means that we use stem cells and platelets to regrow the tissue that's been injured, worn out, arthritic, things like neck pain, back pain, arthritis, shoulder pain, elbow pain, muscle pain, tendon pain, finger pain, all the way down the body to the hips, the legs, the knees, the shins. Some people have shin splints, runners. Regenerative medicine works for all of those things, in my humble opinion. If we're talking to an orthopedic surgeon, we may have some discussion there because they're not big believers in this, or they'd probably be doing it. But I'm not a big believer in what they do either. We like to do things that are conservative and don't cause problems. And I was being trained in orthopedic surgery, and I jumped ship into regenerative medicine because I had a shoulder surgery by my boss, my professor, which made me worse. And I was pretty terrified, as some of you are who have had surgeries. You don't know what's going on. Things don't work out the way you think they're supposed to. And the nice thing about regenerative medicine, using stem cells and platelets, is that it's very conservative. It's just injections, and there's a very, very low profile of sequelae. Sequelae means further problems that come from the procedure itself.
Sounds good.
So I'm going to give out my phone number right now.
Great.
So you folks can talk to me live. You ready? Get a pencil and paper. If you're driving, you probably want to get off the road and write this down. Get off your Bluetooth so we can hear you. And the phone number to talk to me live right now is Dr. Marc Darrow. I've been doing this work for over 25 years. I wasn't the first guy to do it, but I've been told I do the most on the planet. And the phone number right here, right now, you can ask about your musculoskeletal pain, that of your friends, your family, and see if it's something that may work for you or them. Very simple procedures. Walk in, get injections, and walk out. You don't need anybody to drive you. So the phone number to the studio, to the radio studio right now, is 866-870-5752. I'm going to repeat it. Give you another chance to write this down and give me a call. 866-870-5752. There's a couple other things you can do to... Oh, by the way, if you do call in today, we will give you a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Pretty hefty book. It's got a couple hundred pages in it. on how stem cells and platelets work, all the science behind it. There are, I'm looking in the back of the book right now,
264 studies, actually.
264 studies.
Mm-hmm.
It's all annotated here on how this stuff works, so you can get the actual science of it. This is not what I call alternative medicine. Maybe in the beginning, when it was being done 100 years ago, it was considered alternative, but it actually dates back to about the year 1900, a little bit before that. And there were a couple of doctors, Hackett and Hemwall, in Chicago, that did tons of this in the 40s and 50s. And then as they got older, I guess it wasn't being done. No one picked up the ball. And now it's being done all over the world. There's been a huge upsurge, started in the 80s, and now it's being taught all over the place. And I have doctors fly in to see me all the time from all over the world to be trained. I also have a lot of students that come in that want to learn this. So I actually had a new student who's a freshman at UCLA, an amazing person, and she's very interested in this. And I get a lot of pre-med students, a lot of medical students, and doctors in their residencies, and doctors who are out there who want to learn this because they're sick of the old system. They're sick of the Band-Aids of using cortisone injections or medications or sending people to surgery who can have worse outcomes than they started with. So I'm going to give out the phone number to talk to me live right now. It's Dr. Marc Darrow. And the phone number, 866-870-5752. If you want to call my office and talk to my staff for a free consult with them, that's right, it's free. Give them a call. 800-300-9300. That's my office. 800-300-9300. And if you're eager to watch these procedures, watch me do injections, you can go to our website, which is www.jointrehab.com. That's www.jointrehab.com. There's lots of videos on there of me doing injections. There's explanations of how this is being done. And what else about the website? There's a spot on each page to email me. And I answer every email every day. So if you have questions about this, you can call the office at 800-300-9300 for a free consult with my staff. Or you can just go to the website and email me right from there. So, Nita, anything else you want to talk about before I go to some questions?
Sure. There's a couple other things going on in the office. Do you want to talk about that?
Yeah. Believe it or not, although regenerative medicine is used to heal musculoskeletal pain, it also can be used on the top of the head to regenerate hair follicles. So if your hair is starting to thin, this is a great procedure for you. The other thing that it can be used for is pretty amazing. It's called the vampire facelift. Can you believe the name?
I love that name.
It's a great name. You won't forget it because we're using your blood and we take the platelets out and we inject them into your face. We numb up the face so you don't feel the needles. And it regrows the collagen, gets rid of the wrinkles, and makes you look young. We have just as many men as women who do these procedures, and it amazes me. It amazes me to see the change in the facial features.
So let's give the phone number again and get some calls for you. You get a free conversation with Dr. Marc Darrow today. You don't want to pass this up. At 866-870-5752, right here in the studio.
I'm going to give it out one more time, 866-870-5752. You'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and I will pay the postage to get it to you. This isn't one of those deals that you see all the time where you get a free book and then you pay $10. We do it all for free. I want to get the word out, and it's very common for someone to come in from 10 more years ago with a copy of the book that someone gave to them, and they just happened to read it a few days ago, and they come into the office. So yeah. Should we go to some questions, Nita?
Let's do it.
All right. So this one says deltoid injury. What is the deltoid? By the way, you can go to Google, and if there's a term that I say that you don't understand, you can Google it, and in the upper left-hand corner, there's a menu button that says Images. You click on that, and you can actually see what I'm talking about. So this person says, "Hi there. I have a deltoid injury, possibly a muscle tear from lifting weights. Would I be able to schedule a visit?" Absolutely. So easy to schedule a visit. You can just call the office at 800-300-9300. So what is the deltoid? The deltoid is a muscle that covers the rotator cuff, tendons on the shoulder. So many people have rotator cuff injuries. We don't let them get surgery for that. We just fix them. We can spotlight where the problem is using an ultrasound. We look inside the body and we look for those tears. But don't be snookered. I had a impingement syndrome in my shoulder when I was in medical school. MRI showed that. My surgeon cut part of the acromion, which is the top of the shoulder, the bone, so that was shaved off, and some ligaments were cut. That was to open up the shoulder, give it more space to move. Well, what happened? My shoulder blew up like a balloon, my arm was swollen, and I had a fever. And a lot of fear about an infection. Thank goodness I didn't have an infection, but what did happen from that surgery is that I had a useless arm for about 4 years, much worse than the injury I had, which was from weightlifting. So be very careful. The orthopedic surgical model is to go in and cut stuff up, maybe sew it up, but that's really an overkill in most of these surgeries. Why get a surgery and put a knife in there when you can just inject with a needle and heal it up? Now, over the years, that was back in '94 I had that done. Over the years, I've had other injuries in my body. That shoulder, my right shoulder, has been injured a couple more times. Both of those times, I have injected it myself with regenerative medicine solutions and healed it up. If you're watching the video, you can see I'm swinging my right arm up. No problems at all. My left arm, also injured at one point, my left shoulder, and I had a frozen shoulder. That's called adhesive capsulitis from a ski injury when I was an intern in Denver, Colorado. And I was on a ski run called Mary Jane. And it was very steep, and there were big moguls. Those are bumps. And I bumped my way down to the bottom of the mountain, and it hurt. I fell on my chest. I didn't even know my shoulder was injured. And I skied the rest of the day in a lot of pain in my chest. And I drove home, which is about an hour drive. By the time I got home, I could not move my arm. Well, this time I did not go to a surgeon to have a surgery. I learned my lesson when I was in med school and hurt my other shoulder. And I just rehabbed it. I've had to inject it a few times. I've used stem cells on it and platelets. Both my shoulders are perfect to me. Now, if you were to look at my right shoulder, it still has some rotator cuff injuries. My subscapularis, my supraspinatus are torn, and I have a labral tear. Do I have pain? No. So be very careful, because the orthopedic surgical model is to do an MRI or X-ray and go, look, you have a problem, we have to operate. I'm against that. Why have a surgery that can really screw you up? You can get infected, you can make things worse, when you can walk in my office, get a few injections, and walk out and get it healed. Doesn't make sense to me, but that's life, right?
Indeed.
I'm going to give out the phone number again. Ready? Write it down. Give me a call live right now. 866-870-5752. I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And there is a foreword to this book by Suzanne Summers. God rest in peace, Suzanne. You've been an amazing, amazing help to my work. You've always been there for me. We are all so sorry about your demise, and you did a lot of good for medicine. You helped a lot of people. She also wrote a book called A New Way to Age, which has a chapter about my work. On page 302, it says Interview with Marc Darrow. That goes on for, I don't remember, about 15 pages. And I had the good fortune to work on Suzanne a few times. Her son Bruce, her grandchildren, and their friends. And I think we had pretty good luck with everyone we worked with. And I think, the amazing thing is I've been a testament to this work. I've used it on my knees, my shoulders, my elbows, both of them, my wrist. I've had my friends inject my neck, my back, my ribs, and I've had a great outcome every single time. You can't say that about surgery. Speaking of which, I have a question that came in from the website. It says, failed back surgery. Let me see what that says.
It's pretty common.
Pretty common. And to describe what that means, a failed surgery or a failed back surgery, failed surgery, are diagnostic codes that are written into the insurance companies. That means it happens all the time, or they wouldn't make it a diagnostic code. All right, this is a little lengthy, so bear with me. My husband is in a great deal of pain after several surgeries. He had a kyphoplasty for L4 and 5 fractures and for spinal stenosis and leg pain. He has had spinal injections for pain, and they only provide short-term temporary relief. That's a steroid or cortisone injection. His present problem includes spondylosis. That just means the vertebrae are getting worn down and arthritic. With radiculopathy, that means that the pain goes down the legs. It can happen in the neck and go down the arms. In the lumbar region, spondylolisthesis at L4-5. Listhesis means slipping. Spondylo is the vertebrae. So that means that one vertebrae has moved from its proper spot, and it doesn't mean it causes pain. It's a very common thing in Eskimos. They have the highest rate along with football players and with gymnasts. But with Eskimos, it's more of a genetic thing. They have an awful lot of spondylolisthesis, but it doesn't mean they have pain. He also has facet arthropathy. That means that the facet joints, those are the joints between the vertebrae, are arthritic. And not a big deal. Can be, but typically not. Lumbar spinal stenosis, that can mean nothing at all other than on an MRI, it looks like there's not enough room for the spinal cord. That doesn't mean there isn't. Lumbar region without neurogenic claudication, that's good. Compression fracture of L5 vertebrae, that doesn't necessarily cause any pain. Sequelae, T12 compression fracture, again, that doesn't necessarily cause pain. With delayed healing and primary osteoarthritis of the right knee. So we treat these things every day of the week, okay? They don't mean you need to get surgery at all. And just because you have any of these things do not mean that you have pain. So be very careful. She's talking about her husband again. He has limited mobility, and physical therapy is very difficult and painful for him. I do listen to you on the radio and you suggest contacting your office for more information about each person's issue and the likelihood of treatment success. And again, the phone number to my office, you get a free consult with my staff if you call. The phone number, write it down, is 800-300-9300. I'll repeat it for you. The office number is 800-300-9300. We are interested in knowing if your treatments would relieve him of pain and help him lead a normal life. That's the big question. And it's not one that I can answer on the radio. I have to examine the patient and see if I think we can find the pain generator. So the examination is moving the person around, touching the area. We have to touch all the areas around where that pain generator is and find out where the pain is coming from. Do I use an MRI or an X-ray or a CT scan to diagnose? I do not. Why? Because they can show things that are kind of off, but are not the pain generator. Do I have patients get MRIs and X-rays and CT scans? Yes. Why? It can show some really weird stuff that you'd think has nothing to do with the problem. I have found cancers. I have found cysts. I have found things that people do need to get operated on that has nothing to do with their pain that they're coming in from. So I do like to get images. People come and they go, I heard on the radio you don't like images. Well, I like images. I don't like to use them to diagnose a person's pain. They can lead you very astray. If you have them, I want to see them. There may be cases that the exam doesn't give me the information, but it's mainly the exam that I use, the same way my grandfather, who was born in the late 1800s, used to find out what was going on with his patients. They didn't have MRIs and X-rays back then. He used his hands. Now, the sadness for me is when a patient comes in after a surgery that failed, and I ask, did the surgeon examine you? And they say, no, why would he? He got an MRI and he slapped it up on the X-ray box and showed me where the problem was, operated, and I came out worse. Don't fall for that. I'm not putting surgeons down. I love surgeons. But the methodology that's used there is for dinosaurs. You got to use your hands. You got to do the examination. They taught us that in med school. That's the first thing they taught us. Use your hands. Find out what's going on. Do the examination. But for some reason or other, that has slipped away with orthopedic surgery. I rarely ever find someone who's had a failed orthopedic surgery who actually had an examination. So be careful.
That's amazing.
It is amazing. One other thing that's not done anymore, it's called an EMG and nerve conduction study. When I started medicine over 25 years ago in orthopedics, before a surgery was done, the surgeons would send their patients out, and this is talking about radiculopathies, pain or paresthesias down the arms or legs. They'd get an EMG and nerve conduction study, which is a nerve test, to see if those pains, these radiculopathies, or these pseudo-radiculopathies were actually coming from the nerves in the spine, either in the low back or the neck. And many times they don't. So why operate? Why operate on the back for leg pain if that's not the problem? Be very, very, very careful. Any questions about that, Nita?
I don't have any questions because I've seen the research. You've had me read and study over all our years together. So,
how many years now, Nita?
We're in our 14th year.
Oh, my goodness. That's a good relationship we've had.
I know. We're like radio spouses.
I had another radio spouse before you, Dr. Gene Steiner.
Yeah, I remember him.
And I can't track him down. I got his phone number, and I call him every once in a while to see how he's doing. I think he moved down to Arizona. What's the spiritual place in Arizona?
Sedona.
Yeah, I think he went down to Arizona. All right, so we're going to go to a break. Please give us a call at the studio at 866-870. That's 866-870-5752. On the break, you can look at the website and watch me doing videos at www.jointrehab.com, or the office 800-300-9300 for a free consult with my staff.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300.
Anita, can you hear anything on the break?
Dr. Darrow will be back in just a moment. Stay tuned.
Ooh.